One day, when she was still a puppy, I came home from the city and found her unable to stand. I took her to the vet, and based on the x-rays, they said it looked like she had fractured the head of her femur, and that's how it stayed. If the ground is slippery, she prefers to drag herself. She also has a hip problem.
I'm really sorry.
She's going to miss me a lot, I can tell you that, with how quirky she is.
This is Viktor Larkhill. Today we're telling you this beautiful rescue story from the World Animal Awareness Channel. Our collaboration with the channel is helping us reach more and more people, get a wider audience, as well as fundraise in ways we couldn't do it before. Please watch this video. It's a full rescue story. And please don't forget to donate at the end. Everything, all the proceeds from this fundraiser are coming to us. This is really helpful. Please donate. Thank you very much. And watch the video to the end. It helps.
It's an animal world out there. Watch the World Animal Awareness Society channel and feel right at home. Come, sit, subscribe, and stay a while.
Hi, you won't believe this. Yesterday night I was reading comments on YouTube about the little lion when I received a call for help. Our contact at the pound. Somebody left a dog there in a horrible condition. The dog is barely moving. He couldn't lift his head. They told me to please come and help him because this dog was just not gonna make it.
Hello, Ivan. Good evening. Look, we just picked up this male dog that weighs about 10 to 15 kilos. He's very weak, almost to the point of not moving. His gums are extremely pale, he's thin, and doesn't move. I've administered IV fluids, and he has started to tremble. I've also provided heating, but that's about all I can tell you. Additionally, I've administered antibiotics, but he refuses to eat or drink water. If you can lend a hand, we have him here.
I looked at his eyes, I looked at his face, and I saw so much weakness. So I told Jairo to go get the dog and get him to hospital. Have a look at this. We have called him Kiwi.
Ahí está ahí. Es este.
Has he eaten anything?
Yes, but he threw it up.
Vomitado ahí.
When I see a dog in this condition, so exhausted, so ill, with no hope in his eyes, I can't help but imagine how he must have been as a tiny puppy. Little Kiwi, a delightful ball of white fur, scampering around with that adorable puppy waddle, chasing after his mother and tumbling over his siblings. It breaks my heart to see him now, years later, completely dejected and abandoned, nearing death's door. I want you to picture that sweet puppy, and then you'll understand the profound sadness I feel today. We simply must fight to give this boy a second chance at the joyful life he deserves.
¿Puedes tú con él solo?
Sí. Espera, despacito. En la otra. Sí. Ah, sí. Muy bien. Perfecto.
He's so cute. Shall we draw blood?
Yes.
Para empezar, sí.
Does he behave well?
Sí, está
Yes, he doesn't react. He hasn't wanted to move. He's been given IV fluids tonight. Have you noticed his mouth looking bad?
Yes, he has anemia. He's very pale.
Sí, em fas un 10 i em fas un 4 de X con dismania.
He doesn't have a name yet.
Déjame 5 minutos. ¿Puede ser? Estos casos no se pueden hacer cargo ellos. ¿Paso? Sí, tú haz marcha.
Those seem to be tick eggs.
This area is swollen, poor thing.
Huevos de garrapatas.
Ever since he was found on the street, he hasn't moved. He has tested positive for leishmaniasis. Isidore will tell us the results of the blood tests.
En un momentito.
He stays still, no matter where he is.
As we mentioned earlier, he has a severe loss of red blood cells. He should have 6 million, and he has 1,400,000. We have also performed the leishmaniasis test, and the result was positive. He has leishmaniasis with renal failure. The creatinine doesn't yield results, and the bun is over 130. Those are extremely high results.
Kiwi is now at the hospital about to receive a blood transfusion. His condition is terrible. He has leishmaniasis, anemia, and he needs help. Sometimes people ask me, Victor, how do you find all these animals? You search for them. I don't search for anybody. They arrive to me. We set up an organization focusing on helping precisely those that need more help. Kiwi is now at the hospital. He's fighting for his life. Please, if you can, donate. Help us save him. Thank you. Hi. Everybody's attention is placed on Kiwi right now. Kiwi is a dog that we just rescued from the pound. The moment they called me, we knew we were his only hope. We went there, we got him, and we took him to our hospital, and since then, he's been in intensive care. His condition is really complicated. He has advanced leishmaniasis, he has terrible anemia, and we suspect he has kidney failure. Please have a look at this. This is Kiwi.
You can see he's very pale.
He's also infested with ticks. Are you going to do an ultrasound on him?
Yes, we've conducted an initial analysis. What we can see in the mucous membranes is confirmed in the blood work. He has very few red blood cells. We're going to make sure there's no free fluid or problems in the abdomen, and then we'll start the blood transfusion.
He's very pale.
Yes, as soon as we start the blood transfusion, the situation will change. His bladder is full. We need him to pee. Have you seen him walk?
Since he was rescued, we haven't seen him walk, though I believe it's due to his condition, as well as the fear he has. He's very weak.
Miedo, el shock que tiene y el estado en el que está, claro. Está súper débil.
Is this the same thing you did to Eros?
This is catheterization.
We had to empty the bladder a bit to get a good view of the abdomen on the ultrasound.
There's a stone in the urinary bladder, but no free fluid.
That's the least of his worries.
Exactly. The catheter went in well. We managed to extract urine.
Hang in there, Kiwi. Could you pass me a gauze with alcohol, please?
Ahora en cuanto podáis le dais una pastilla.
Sí, no.
Eso no hace falta.
What have you given him? Saline to hydrate him.
Yes, now I'm going to calculate the blood dose.
Vale, ok, gracias.
This is a pipette for fleas and ticks.
Vale.
Y garrapatas. Perfecto.
Ahora sí.
Kiwi is fighting for his life. We have performed a blood transfusion. His condition is grave, but he's fighting. When you look at him, you see his state of complete weakness. You just wonder, how did he get to be in that position? How could they do this to him? We face this every day, and this is our fight. This is why we exist. This is why we're here, to take care, to help of animals like Kiwi. Please, if you can, donate. Help us save him. Thank you. Hi. It's been a very long weekend. Last Friday, we uploaded an update on Kiwi, and I told you that his condition was really complicated. We had just given him a blood transfusion. And I told you that we were going to continue fighting for him. And that's what we did. I'm going to show you what we have done over the weekend. Have a look. This is Kiwi.
Let's see if he'll eat a bit.
Un poquito. Ahí está inapetente aún,
Now we'll check the blood test results and proceed with another blood transfusion session.
Y vamos a ver cómo lo lleva y le vamos a hacer otra sesión de transfusión. Toma.
He doesn't want to eat.
Bueno.
Aitana is taking note of the times for the transfusion rate.
Para la velocidad de transfusión, ¿verdad?
We're going to administer the second blood bag. And now Isidore will tell us about the blood tests done this morning.
¿Cómo ha visto las analíticas que le han realizado esta mañana? Venga,
Come on, Kiwi. Aitana has inserted the catheter so the new blood can start flowing.
Para que vaya entrando esta sangre nueva.
We're going to ask Isidore how it looks. I think he's in bad shape.
Bastante apagado. Venga, Kiwi, ánimo, va.
We've tried to feed him, but he doesn't want to eat. Isidore, how do the blood tests for Kiwi look?
We did the first transfusion yesterday. He continues today in that critical condition. Kiwi could pass away at any moment. There's been an increase in hematocrit and a rise in red blood cells, which is what we hoped for. Today we'll do the second transfusion to see if we can get out of the high-risk state.
How's the creatinine?
Today it's at 4.8. Now it's yielding results. Previously it was above 12 and showed no results. And the Bune is quantified. We'll see if all these renal failure issues resolve in the coming days. We can't move any faster.
Now he doesn't want to eat.
Until we get the creatinine below 3, he won't eat. But we are administering food intravenously.
Vale, perfecto, gracias.
Are you giving him a protector?
Yes, omeprazole and another one orally.
Had it been administered before?
Yes, we gave him one for vomiting. He vomited a bit last night.
Vale, por boca.
It must have a very unpleasant taste.
Seguro que tiene mal sabor.
We've increased the speed so the blood enters faster.
Para que entre un poquito más rápido, ¿no?
Here we see the blood bag.
La bolsa.
There's little left, but I see him in quite a bad state.
Estaba bastante fastidiado, Chiqui. Vale. Me dejo un ratito más, ¿vale?
I'll return in a while. Did you give him chicken?
Yes.
2 hours have passed.
Que voy un poquito de comida, va. ¿Qué quieres? ¿Quieres un poquito? ¿Un pollo? Bueno, por lo que veo sí que ha bebido agua. Tenía un dedito.
He's drunk water but doesn't want to eat.
No tiene pinta de que haya comido nada. Así que habrá que
We must wait for the blood transfusion to take effect.
La sangre que le hemos transfundido y se va a quedar
He will
aquí.
stay here.
¿Qué vamos a hacer? Pero vamos, no sé. Estaremos
We'll keep a
todos
very
muy
close eye on him.
de él. Vamos
Let's
a
see
ver a
how Kiwi is
cómo se
doing today.
encuentra hoy. Hola. ¿Qué pasa? ¿Cómo estás?
How is
¿Cómo
Kiwi?
está Kiwi?
We're very worried. The renal function has worsened.
Did you do blood tests this morning?
Yes, we repeated them, and they don't even yield results. As the renal function deteriorates, he could go into multi-organ failure. The problem is renal failure. Such a pity. It's a renal failure caused by leishmaniasis, very characteristic. Leishmaniasis is a ticking time bomb.
Hola Kiwi, buenos días.
Why is his neck like that?
He's got a bit of edema. We're going to carry out the next transfusion now, so his hematocrit doesn't drop too much. And we're going to treat the leishmaniasis. His leishmaniasis is very severe. They are immune complexes that form in the renal glomeruli and cause renal failure.
He's not perking up.
Just when the chances of finding a good family were opening up, we find ourselves in this grave situation. So frustrating.
Vale, ¿lo llevas? Sí.
There's no free fluid.
We're administering another blood bag.
De sangre. Vale.
In half an hour, we'll increase the speed. Hang in there, little one.
I'm gonna be completely honest here. Kiwi's situation is bad. It's bad, and I'm afraid we are gonna have to let him go. I don't know what to say. Really. When we get a request for help, animals like this have to be treated. Very often, they make it. Others, they don't. It is now midday here in Spain on the Monday. This afternoon, I'm going to talk to Isidore and we're going to take a decision. And whatever it will be, it will be. And it will be the best for Kiwi. I promise you that. Lots of love, and I will see you tomorrow. Take care. Hi. Something terrible has happened at our shelter. It's about one of our dogs, India. India was rescued 9 years ago. She was found in a local park inside a cardboard box. People abandoned her because clearly, well, she was eating, but whatever she ate, she was throwing up. We took her to the hospital, and she was diagnosed with a heart condition called ductus arteriosus. The only way to save her would be to have an open heart surgery. India was operated, and she survived. She made it through, but unfortunately, she was left with a condition called megaesophagus. Megaesophagus means that the esophagus stops working, so it doesn't fulfill its vital function of conducting the food to the stomach. So it's a useless esophagus. The only way for her to eat is to eat standing up on a Bailey chair. This is how we have to eat her. Little by little, with small portions of kibble. Unfortunately, she has to eat kibble because of this. And little by little, making sure that she gets it from the top, and then the food goes straight down. You have seen our videos, you have seen videos of India eating, standing up in that chair, always with a lot of care, with a lot of love. India has done great over the years, but we've had to take care of her very carefully. Every single time she eats, you have to be very careful, because there's always the chance that she might throw up and she might inhale the food, and this may lead into problems. This is exactly what happened last night. She ate something, she threw up, she vomited, and then it went through the other conduct directly to the lungs. It looks like India has pneumonia. She's now at the hospital. Have a look at this. This is India.
Here I am with India. You all know her well. She has a problem with her esophagus, and it's very likely that we'll do a CT scan. At least she's here, stabilized, but she's making this noise when she breathes that isn't good at all.
Que no es nada bueno.
Look at you now, and how still you are. We're going to place an IV in her other leg.
Her temperature is 38.7, which is good.
What are you giving her?
An antibiotic.
We're going to take an X-ray of India to decide what to do. Are you going to sedate her?
No, we'll try without sedating her, because she is behaving very well.
Dogs' esophagi don't have their own musculature, that is, they don't have striated muscle. It's just a tube that food passes through. Therefore, we need her to gradually start passing and tolerating food. Right now, Her entire esophagus is dilated.
She vomited twice yesterday.
If India was fine and this happened after feeding her, it can't have closed completely. On the X-ray, it doesn't look closed. A fibrous ring could have formed inside. We need to see it because she rejects almost all the food she ingests almost immediately. If that happens, it's a life or death situation. We need to open her up, insert gastrotomy tube. There is no other option. It's normal for her to cough because her esophagus is very dilated. Right now, we have to ensure that she doesn't develop sepsis and try to get her to eat. If her condition worsens, what we need to do is place a gastrotomy tube, get her better, and then dilate. But I think she's too weak to tolerate anesthesia.
Have you seen her lung? It's much worse.
Let's see.
This is from just now.
She's developing a very severe case of hematogenous pneumonia.
She's in a serious condition, and it's getting worse.
She's aspirated, she has pneumonia, and I suspect it's hematogenous pneumonia. She's not strong enough to have an anesthetic. She needs an oxygen supply in her cage, antibiotics, and fingers crossed that she doesn't aspirate again.
Hang in there, India. We're all here for you. Everyone is with you.
We have no idea how it happened. We suspect that she ate food from another dog, but we don't really know from whom. They all eat so quickly and they are all so careful. We are so careful, especially with India because she is special needs. India is now at the hospital in intensive care. She's fighting for her life. She's suffering from pneumonia. It's a really complicated condition in her case. We need your help. Please donate. Help us save India. Thank you. Hi. In yesterday's video, I told you that India, one of our most beloved dogs, is at the hospital fighting for her life. I told you her story. I told you how she was rescued. She was operated from the heart. It was an open heart surgery, how we saved her life, and how for the past 9 years we have dedicated ourselves to provide her the best life possible. You have seen India over the years in multitude of videos. You have even seen her in a funny video where she jumped so high that she hit my nose and nearly broke it. She's a delightful dog. She's one of the hearts of Let's Adopt, one of the hearts of the great house. But India is now fighting for her life. She's fighting against a pneumonia caused by aspiration. Some of the food she ate and vomited went through the other way and landed on her lungs, and this has landed her in hospital. Her condition is critical. She's in really bad shape, but we're doing everything we can to save her. And I promise you, right now the entire team is working on her. We're sparing no expense to save our baby. And this is where you come in. I know every time I come out with a plea, you'll do your best. I know that. We try to show one rescue a week, although usually it's much more than that. There are lots of stories that are not told. There are many treatments that we don't get to tell here. Whenever there's an emergency, I always come out here and I ask for help. I know India is not a new case. She was rescued so long ago, but precisely because of this, because we have shown the commitment to provide long life and wonderful lives to our animals, I expected that people will understand and will help. Alas, that didn't happen yesterday. Let's see if we can make it happen today. As I said, I understand India is not a new case. There is no novelty factor. There is nothing spectacular about this rescue. But she's a family member. She's a dog that has been with us for nearly 10 years. Provided her, she has given us her life. We have sworn to protect her and take care of her, but everything depends on whether this community reacts when it's needed or not. To run a shelter is very difficult business. It's an endeavor that I don't wish to anybody. Very often people write to me and tell me that, wow, I wish I could do what you do. I wish I could open a shelter like you or Takis. But you have to understand that this is not a game. Both Takis, myself, and so many other people that run shelters, whether they do it well or less well, our entire lives are dedicated to this. And above all, we are sworn to protect our animals for life. We make a big effort in finding them homes. That's the whole point. That's why we're called Let's Adopt. Let's Adopt means let's adopt them out. Let's find them homes. But sometimes that is not possible. When this is not possible, then we're committed to protect them and take care of them for life. And this is one of these cases. India is now at the hospital. She's fighting for her life. She has chances. She has. But everything depends on whether we can take care of her, whether we can pay for her treatment. And I tell you, it is not cheap. You're all aware of the increasing prices in veterinary services. It is happening everywhere. Actually, we're going to make a video about that very soon. But this is something that is affecting us all. The fact is that she is 24/7 in the intensive care unit of the hospital. She has people with her 24 hours a day. We're doing everything we can to save her. This is an amazing animal rescue community. We are over 1 million people. You know, there's always people that say, well, if everybody donated $1, we could do, but that's not going to happen. Not everybody is going to donate $1. Not half of the people are going to donate $1. No, this is all in the hands of a handful of people that video after video are motivated enough, are committed enough to help us continue taking care for these babies. This is why I'm making this video today. We are showing our commitment, we're showing the way we work, we are showing our integrity to ask for your help. India is at the hospital fighting for her life. Please, let's not let her fight alone. Please donate. Help us save India. Thank you. Hi. For the last 3 days, we have been trying to save India's life. India, as you know, has megaesophagus, a condition that renders the esophagus useless in its mission to take to the liver the food to the stomach. She has to be fed through a Bailey chair. She sits on a chair and then the gravity does the rest. With India, we have always been really careful that she only eats what we feed her by hand using the chair. And there has never been an accident. 9 years, really good. Now, statistically, animals that have megaesophagus are prone to vomit, to regurgitate, and then to inhale that vomit, creating conditions like these ones, pneumonia. Nine years, extremely careful, never had a problem until 3 days ago. She got something from the floor, she ate it, she regurgitated, and she inhaled it. Result, pneumonia. She's fighting for her life. Have a look at this. This is India.
We're going to do a chest x-ray on India. We'll try not to put a muzzle on her so that everyone can see her gentle face. But if necessary, we will.
Has she lost weight?
She has lost weight, yes.
Let's try to do an X-ray in a Sphinx position.
We're going to draw blood from India to do the CBC and see how she's doing. Now we will explain how the X-rays went. India behaved very well. We expected no less from you. A cat, just what we needed. That cat belongs to the clinic. He's our friend, okay, India? Those of you who know India and have seen her in action in her day-to-day, when you see her now, you'll understand that she's really unwell. Now they will give me the results of the X-rays and the blood tests to see how she's doing. But we can already see that she's really sick. Thankfully, she's very well taken care of here and gets lots of cuddles. Isidore, how is India's CBC?
There's a slight improvement. She had a severe drop in neutrophils. And today they have improved, normalized. There's leukocytosis as a result of the bronchopneumonia. The situation is grave. She's going to need time to get better.
Show us the X-rays.
We've updated India's X-rays. We can see that her bronchopneumonia is very slowly improving. This is from the other day, where we can see her megaesophagus, the area that was operated on for arteriosus ductus, on both today's X-rays.
Is this today's?
Yes, both are from today.
What can you see here?
We can see that the bronchopneumonia is slowly improving, which is also reflected in her breathing, which seems slightly easier. The inflammation on this X-ray is not as pronounced as in the previous one. This is something that progresses slowly. These situations are grave, and many animals don't make it.
He consultado porque yo soy me gusta saber, muy curioso y tal, y me ha comentado Andrea.
Andrea told me that the problem when food goes down the wrong way is that the acid can destroy the lung.
Entonces el ácido lo que hace es destruir el pulmón, ¿es así?
Yes, now it is gradually being reabsorbed.
Then the lung regenerates, and that's where we hope we are now.
Y es eso a lo que estamos,
Exactly. Many animals die as a result of bronchopneumonia. We had a case when, after vaccinating a dog, we gave him a treat. The dog inhaled it, and we were unable to save him, even though he was hospitalized and monitored for several days. It was absolutely awful.
Aspiration pneumonia is a medical emergency, and we did the right thing rushing her here.
We will be keeping an eye on her. You did well to come so quickly.
Okay, gracias.
We have the entire team working on India's case. Jorge is advising Isidore, and they are sending us reports every few hours. The entire team at the hospital is taking care of her. She's an amazing little dog. For 9 years, there was not a problem, and now, pneumonia. Unbelievable. Anyway, I know India is not a new case. I know it doesn't have the novelty of the animal that just has been rescued. I know many of you are used to seeing her healthy, and you may think, oh, well, let's adopt and take care of her. But the truth is that we can't. Without your help, we can't. We can't do anything. Please, if you can, donate. Help us save India. Thank you.
3 days ago, I uploaded the last update of India. India, as you know, has been at the hospital for nearly a week fighting for her life. India has pneumonia. The condition is terrible. Animals and people that have it cannot get enough oxygen into their lungs, and eventually, if it doesn't resolve, they may even die. This has been a very long and a very difficult weekend, but I want you to see how India is doing today. India.
Let's see how Miss India is doing. Here's her medication.
I've spoken with Viktor, and he told me he'll grind the chicken breast for her. The butorphanol is applied directly to the gum. You have everything ready.
Well, well, quite the arsenal.
These are the last 2 checkup X-rays before she leaves for Valencia. We can see that the image of the lung parenchyma is improving day by day, which gives us a lot of peace of mind in letting her go home.
She's very eager. You can hear her from here.
She can't stand it anymore and says, "I want to leave for Valencia. I don't want to be in the Benissa hospital anymore." We see that the inflammation of the megaesophagus has also improved, so super well.
Let's look at the blood work.
There's a response with leukocytosis, which is good for the aspiration bronchopneumonia. And the neutrophils are also staying elevated. Therefore, we will continue the treatment with the 2 antibiotics for 10 more days, which have worked wonders for her. We've also done a little check because of all the medications we're giving her, and the kidney is functioning well. She also maintains good albumin levels, so wonderfully.
I'm taking India. Her friends are waiting for her eagerly. You've given us the scare of the century. Viktor is looking forward to seeing you and getting a little tap on the nose from you.
She can't believe she's leaving.
Venga, aire puro.
Momentazo.
Vale, ok. Venga. Pink. Venga, que nos vamos.
Going home.
Hala. Tienes ganas.
You're eager, huh?
Bye.
How eager I was to get out of there.
She's skin and bones.
I never knew love would come and find me.
Que ya te he traído,
I've brought you home now. Couldn't bring you sooner.
Garantes.
Took me by surprise. So many things that I wanna do. Do you? Can you visualize?
Nancy, your friend has arrived. Have you said hello?
La has saludado bien.
It's so hard to say all the things I want to. I'm waiting to let you know how much I want you. When I think about you, I feel la 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 la. When I think about you, I want la 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 la. When I think about you, I feel.
Bueno, estamos aquí ya en casa.
We're at Great House. India is now with her friends.
Suyos. India. ¿Estás contenta? ¿Estás contenta ya del viajecito?
We thank everyone who has followed her.
Que te ha seguido. Venga, nos vemos pronto.
India, as always, doing her own thing.
Hola.
She's recovered.
Nada.
She's back to say goodbye properly. See you soon.
Say all the things I want to, but I'm trying. Oh, to find a way to get close to you. It's so hard to say all the things I want.
It has been a very long weekend, but I'm very happy to say that India made it. She left the hospital. She's going to continue her treatment at the Great House for a few more days, and then she's going to go back to the hospital for a checkup. But she made it. And I'm really honored to say that without you, she just wouldn't be here. She's alive because of you. Imagine running a rescue where you have so many old animals that need treatment, that need care. Without this community, we just couldn't make it. So thank you very much. Thank you for being right by our side. Thank you for donating. Please, if you can, continue doing so. There's a link at the bottom. You can donate towards India's treatment and towards the treatment of everybody else. Thank you very much, and I will see you tomorrow. Take care.
Guys, I'm sorry. I don't know if I should show you my face. It's so bad today. It's so bad. Anyway, here, look. It's all over the place. I'm just heading to the dentist. I need to fix that nerve. But I promise you that I will be here every day. And it's very important that I'm here these days because, as you know, we are having a huge problem with our vet bill. I need to make these videos. I need to get your support. Now, watch this video. Beginning to end is very special because it shows that even in our weakest moments, in our worst times, we will not stop at saving lives. I want you to watch this video till the end. If at some point you want to donate, donate. If you feel moved for what you're about to see, become part of it. But if you don't, just watch it till the end. Let it go and donate at the end. It's very important that we get you on board. We need to have recurrent donors, otherwise we're going to be struggling for the rest of our lives. Okay? Now watch this. It's very special. Enjoy it.
It's 5:10 in the morning and Ivan just pulled a Carla.
Iván acaba de hacer una Carla.
Sí.
Ha hecho un Carla.
Meaning he overslept.
Iván.
Who's that? Hi, Gyro.
It's 5:20. He just pulled a Carla.
Un Carla, en toda regla.
He's overslept. We've been waiting outside for 3/4 of an hour. Unbelievable.
Hey!
I've always wanted to do that.
Siempre lo quería hacer.
And today I had the chance to do it to 2 people at once.
I am so tired. No, venga, café. We're gonna have a coffee and then I'm gonna drive. This one, I don't trust in the car. So, I realized that you don't know this guy. His name is Darío. He's from Argentina. He joined us 3 months ago. He's doing great. But today is his test, the ultimate test. He's gonna drive the Let's Alone car. Let's see how he does.
No.
He braked with his left foot, used the wrong foot.
He thought it was the clutch.
But it was unintentional.
He's used to driving a manual car.
We're going to keep watching Frank Cuesta's video. He's going through a tough time with the sanctuary, but it looks like things will work out.
Okay, so we're gonna go in there. Nikki is this mastiff mix that has a really bad eye problem. We're gonna see that. In that house there are 10 dogs. This is a rescuer that has lost her way a little bit. People gave her dogs and she couldn't find homes for them. So we're gonna try to help her. Hola.
Uy. Hola. ¿Se ha visto? Ah, no. Hola. ¿Qué tal? Hola.
It was the sprinkler. Come this way. It's her. If the ground is slippery, she prefers to drag herself. She also has a hip problem. One day, when she was still a puppy, I came home from the city and found her unable to stand. I took her to the vet, and based on the x-rays, they said it looked like she had fractured the head of her femur, and that's how it stayed. Is that what it is, or not? She was walking fine at 3 months old. And then all of a sudden, this happened. I'm not sure how it happened.
It's okay. We'll check what's going on and treat her. I do notice she's a bit overweight.
Well, she eats half of what the others eat. I try everything I can to keep her from gaining weight.
Your dogs are doing great. I'm really sorry because during our call, I got the impression they weren't being well cared for.
I can assure you they live better than I do. She's been raised with me and hardly lets anyone else touch her. It's not just an issue with her eyesight. I think she might have some kind of mental issue because she didn't develop properly. You know what I mean? She's got a very different personality compared to other dogs.
How old is this dog?
She'll be 2 years old in September.
Dos años.
She's 2 years old. Monse, for heaven's sake. If you told me she was 10 years old, I'd say, she's been with you all her life. Keep her. But she's only 2, Monse. The problem isn't with the dog.
But I can't let her go. She's the one I love and care for the most.
I understand. But the problem isn't with the dog. The problem here is mental. I'm sorry, but think it over.
De verdad, analízalo.
I'm really sorry.
It's okay. You're going to make me cry. I don't want to cry because I've been up all night too nervous about your arrival. I take really good care of them. I buy them liver, I cook chicken livers and mix them with their kibble so they're not just eating kibble. Yes, they're a little chubby, I admit it. But they live well. They're not cold. They don't sleep outside like my neighbour's dogs. In the summer they sleep wherever they want because I leave the doors open, and they come and go as they please. In winter they sleep inside, by the fire, on their beds, on the couch, wherever they like, sometimes even on the bed. I always make sure they're comfortable. I believe that if you have an animal, you need to take care of it. They can't just be guard dogs, and they are guard dogs, by the way. I don't have any alarm system. All the houses in the area have been broken into except mine. You can pet her, but be careful because she's fast and can bite. Other than that, she's affectionate but a bit quirky.
Does she do that to you too?
Yes, she does. That's why I told you she's special. I don't think it's just an issue with her eyesight and hip. I think she has some other problem too. I'm not sure what. I don't know if dogs can have autism or something similar, but she's quite unique. I was petting her and suddenly, without warning, she tried to bite me. I'm quick, but one day she might succeed.
Well, it's cozy in here. The photos you sent didn't do it justice.
That's because Nikki rarely ever wants to leave the house. Today she came out on her own, but most days I have to try to coax her out with the food bowl and she won't budge. She's very stubborn. She's the queen of this room.
It's not easy.
That's why I use the harness. Yesterday I tried to put on a collar, the only one that fits her. And aside from almost getting bitten, you have to wait for her to decide to get up, and then you quickly attach the leash. She takes the muzzle off by herself.
I made a mistake. I was too harsh on you, and I'm truly sorry.
Listen, we all make mistakes. I just wanted you to understand me.
You didn't explain yourself well. I thought it was a different situation. I thought you were one of those people who had lost control and had too many animals. It's a common thing. I've seen a lot.
You mean Noah syndrome, right? Animal hoarding.
Yes, exactly.
My instinct would be to take them all in, but I know I can't.
I have 10 dogs, like you, so I know what it's like to have 10 dogs. A person can have 10 dogs without having a pathological condition or a psychological problem. But I made the mistake of judging you, and I shouldn't have done that. Your dogs are extremely well cared for.
I always try to make sure they're okay. They're my babies, I always say that. They love me a lot, and I love them just as much.
But the advice I gave you, what I asked you to do, speak to a psychologist. That's really important, because you need the strength to carry on with what you've got.
I know my problem isn't hoarding animals or saying goodbye to them. My sister and my friends have been telling me for a long time that I need to let go. But that's the hardest part for me. I worry a lot. They get sick, and when they die, because they will die sooner or later, I struggle to accept that death is part of life. My husband is at his wit's end. He says, it's not that you're hoarding animals, it's that you suffer too much for them. If I have to get up 1,000 times a night to give a dog water because it can't get up, I'll get up 1,000 times. I don't mind how many times it takes. And if I have to spend sleepless nights like when they were puppies, I'll do it. I don't care as long as I can handle it. My problem is that sometimes I put everyone else before myself. I think that's my big issue.
Well, will you work on that? I'll put you in touch with someone. Please work with them.
Yes, because I know it's going to be very hard when they start to pass away.
What's the winter weather like here?
It's brutal. So cold, it's terrible. It doesn't snow here, but I wake up in the mornings to find the water bowls frozen.
Are you protected from the cold inside?
No, even with the fireplace and the butane heater, it's only 14 degrees inside.
There's not much insulation here, I see. Does this door close properly?
No. I tried to fix it as best I could, but it doesn't close well.
Dario, are you a handyman? Are you good at fixing things?
Yes.
Well, maybe when we come back to bring Nikki, you and Martin can stay here for a few days and do some repairs, right?
Of course, whatever's needed.
Really? But you're not obliged to. We do what we can. But with the physical limitations my husband and I have, I've learned to do things I didn't know I could do. You'll be coming back very soon, okay, darling? She's going to miss me a lot, I can tell you that, with how quirky she is. And I'll miss her too.
Vale.
You'll know at all times where she is and how she's doing.
I trust you. I know you'll take good care of her. I don't trust myself as much to handle all this.
You'll see, everything will be fine. It won't be long, and when she comes back, she'll be slimmer. We'll check what's wrong with her hip joint and do everything we can.
Thank you so much for everything, it's priceless.
We'll help you with whatever we can.
They're going to give us a hand with the house.
When we come back, we'll ask the maintenance team, 2 or 3 people, to stay here for a week fixing things.
We'll make sure they're comfortable here.
Wow, this family is so great. Yesterday when I spoke to her on the phone, I was a bit harsh because honestly I thought that this would be different. I thought the pictures she sent me, the house looked really messy, and there were too many dogs, and the way she spoke, I thought that maybe, I don't know, there was a little bit of a hoarder situation, but it's not like that. These dogs are so well kept, and yeah, true, they have financial problems, but these people didn't choose to have these dogs. They had 3 dogs, but then they dumped these puppies on them, and they couldn't say no. They kept them, because over here there are no good families. There are very few good people here. So they were really afraid that these dogs will be put to work, abandoned in some fields or something, and they ended up keeping them all. And now they are over their heads. They really are struggling. But I tell you, these people are so great. So great. I'm so glad that we did this. So we're taking Nikki back to Valencia. We're gonna cross the country again, and we'll be taking her to the ophthalmologist on Monday, and she will also need to have a full checkup to look on those hips, and maybe a thyroid exam. I tell you, Nikki is a handful, but she's really great. It's a really, you know, what is the right expression? Endearing dog. She's endearing. She looks at you and she kind of snaps, but she doesn't hurt you. It's like her way to interact, and she's endearing. She's an endearing lady with problems. So we're gonna help. We're definitely gonna help. Hay una tormenta aquí increíble. So you've seen it. I'm now heading to the dentist,
I think tomorrow maybe it's not a good idea for me to come out on camera, but anyway, it's not gonna be worse than this. Please join us, donate, we need you. Hi, it's about Nikki. We drove across the country to pick her up, to rescue her. We actually thought that her issue was just an issue with her eyes, but it turned out to be much worse. When she arrived to the Great House, she started having shakes. She wasn't feeling well. She wasn't standing up. We drove her to the hospital and we did all the necessary tests. There is a big problem with her glucose levels. She has hypoglycemia and it goes up and down. So we have really investigated this, and the results, you need to watch this. Please, this is Nikki.
She weighs 53 kilos and 250 grams. Let's see if she can see or not.
It seems like she can only partially see.
Complete blood work, pre-surgery, because she'll be seen by the ophthalmologist in Valencia. Let's see if we can sedate her a bit to take some hip x-rays.
How old is she?
2 years.
She's young. Look how she supports herself. She's got hip dysplasia there.
We're going to sedate her a little to take the hip x-rays.
To make her more comfortable.
Plus, those positions are painful.
I'm going to put in a line because when we do the hips, it'll bother her, and she'll need propofol. She has difficulty standing up, but she's not really limping as such.
Well, a little bit, yes.
We were discussing her age because, radiographically, she doesn't look like a dog that's almost 2 years old. She has a very advanced process of osteoarthritis in her spine called discospondylosis. On the other hand, we did the x-rays of her hips, and they're in pretty bad shape, especially the right one. She has a fairly pronounced hip dysplasia, with half of the femoral head already out, and the joint area has lost its healthy joint shape.
Let's check her glucose because it's showing a bit low in the blood tests.
Ahí en las analíticas un poquito bajo de rango. Ahí.
It's low,
Está bajo.
meaning her glucose is a little down, and we need to give her intravenous glucose. That's why she seemed weaker and more tired during the consultation.
The following day, we tested Nikki's glucose levels and noticed that the results fluctuated significantly, ranging between 46 and 90. We were very concerned about this, as it was unusual for her levels to be so unstable. We decided to urgently take her back to Vet Clinic's hospital to find out why this was happening.
Bueno, nos vamos de urgencia.
We're rushing out with our friend Nikki because her glucose is very low.
Porque el azúcar lo tiene muy bajo, la glucosa,
and we need to do more tests. So we're heading to Benissa to see what they say. The problem is that her glucose isn't rising.
No le sube la glucosa.
The first thing we're going to do is check her glucose levels. If it's low, we'll need to supplement her with intravenous glucose, and then we'll do an abdominal ultrasound to see if there's something that could explain the hypoglycemia.
She hasn't eaten anything.
Since when?
She ate a little yesterday.
El primer día.
Has she had any vomiting or diarrhea?
Yes, she's vomited, regurgitated food, and also vomited a hairball.
Let's do the ultrasound and see.
Rosa has given her a sedative shot, and we're going to do the ultrasound now. I'd like to take this opportunity to say, don't let your dogs get overweight, because it makes it very difficult to do tests, ultrasounds, and administer anesthesia. They could die over something minor.
There's a cyst on the cranial pole of the right kidney, 1 centimeter in diameter, which is usually genetic. From the ultrasound, I've seen that her pancreas is slightly inflamed. I don't see any nodules that would suggest a pancreatic tumor, which could explain the low glucose. I didn't see anything, but we can't rule it out entirely. It's rare for a young animal to have a pancreatic tumor, but it could be one of the causes. I noticed some mild degenerative changes in the kidneys, and one of them has a cyst. These are usually genetic problems, and as long as the kidneys function well in the blood tests, they generally don't cause problems, except in the long term, when they may grow and eventually lead to kidney failure. Her spleen is slightly heterogeneous. We've repeated Nikki's blood tests to see if there are any changes. She's not anemic, and we're at the same point with the blood, but some changes have shown up. Part of her white blood cells are slightly elevated, and at first her platelets seemed low, but that's not real because there are aggregates, so it's not a true count. In the other part of the blood test, we see that her glucose is higher than normal, at 166. This is normal, since the blood sample was taken after giving her glucose intravenously. This is a good sign, because she's responded well, but we need to keep monitoring to see how her glucose levels evolve. She still has elevated globulins, which are part of the body's proteins. They can indicate something inflammatory or neoplastic. I'd like to rule out any pancreatic issues. On the other hand, there are endocrine diseases that can cause this kind of situation. We'll do a CT scan to rule out any nodules in the pancreas, and at the same time we'll check if her adrenal glands are small, though they seemed fine on the ultrasound.
She has the bone structure of a 10-year-old.
And she's only 2.
All that black area is fat, and so is this. Nikki's body condition is unbelievable. We have Nikki's CT scan here. We've done a full reconstruction. This is her spine, and these are her ribs. All of her abdominal organs would be here, and as we saw in the x-rays, she has a quite advanced spinal issue. Here we can also see how she has discospondylosis, which is an osteoarthritis process in her spine, in a patient who's currently less than 2 years old, but already has an advanced condition. One of her adrenal glands is smaller than the other. Usually, when there's Addison's disease, which is an endocrine disorder that can explain why Nikki's blood glucose is low and stays low even after eating, both adrenal glands tend to be smaller. In her case, only one is small, and the other is normal. It might not be the cause of her hypoglycemia, but we need to rule it out with a specific blood test.
Besides the blood test, any other tests?
We'd like to do 2 specific blood tests. One is to check her insulin levels. To do this test, we need to catch a moment of real hypoglycemia. And we also want to do an ACTH stimulation test to rule out or confirm Addison's disease. That's the plan for now.
After analyzing everything carefully, the CT scan, the glucose levels, and everything, turns out that what she has is a tumor in her pancreas. It's called insulinoma. And the only way to save her is going to surgery and take it out. She needs to go into surgery as quickly as possible, and we need your help. Please, if you can, that's Nikki. Help us save her. Please donate. She needs you. Hi. I need to apologize. Yesterday's video, I failed miserably. I failed at my job. My job is to present each rescue case in a way that is clear for everybody and that encourages you to help the animal. That's what I do. If I don't do my job properly, I fail, and in the end, the animals suffer. Yesterday, I presented a video that didn't clearly explain what was the issue with Nikki. But you see, it's not entirely my fault. When this rescue started, I went to rescue Nikki because she had an issue with her eyes. Immediately, we realized there were so many more things. So we took her to our hospital, and we started the process of test and CT scan and ultrasound and all of that. But yesterday, in that video, I didn't show you that process in a clear, concise, and digestible way. It was a mess. We had vets telling you something about discospondylosis. Then it changed to talking about possible issues with her, hypoglycemia, Addison. They tried to explain things. It wasn't clear. People didn't understand what was the issue with Nikki. I'm going to tell you that now. Very clearly, very short, very simple. Because at the end of the day, that's the way messages go through. Nikki has a pancreatic tumor called insulinoma. That tumor in the pancreas means that the production of insulin is compromised, is damaged. So she has severe hypoglycemia. It changes all the time during the day. That creates seizures, that creates behavioral issues, and she can barely move. She is exhausted all day.
Nikki. Ay, ay, ay.
His eyes are becoming more and more swollen.
Bien. Ay, 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 ay. ¿Quieres? Vamos.
There are people that suffer from the same issue, and they know how terrible it is. It is not diabetes, it is not Addison's, it's a tumor in her pancreas. And we need to take it out. Very simply. Very simply not. It's a very complex surgery. It has taken us nearly 2 weeks to completely and fully identify the issue. We had to perform many tests. Many people had to just look at it and agree on something, and it wasn't easy. This is why yesterday's video is such a mess, because I just drove you through the chaos of multiple opinions and diverging views and evolving views. Anyway, finally, we know what it is. It's an insulinoma, and we need to go into surgery. And we need to do it as soon as possible, because the longer it takes, then the worse the chances of recovery they are. Insulinomas are tricky. You operate them, and then 1 year later they're back, and then you have to operate again. It has happened to us before. One of my own dogs, Spotty, suffered from this, so I know how terrible the condition is.
Que te coge. No le muerdas. Oh, que te come.
But I also know that if we operate her now, we're going to buy time. And that time is going to be beautiful and gorgeous for her.
You're going to make me cry. I don't want to cry because I've been up all night, too nervous about your arrival.
Your dogs are extremely well cared for.
I always try to make sure they're okay. They're my babies, I always say that. They love me a lot, and I love them just as much. I know my problem isn't hoarding animals or saying goodbye to them. My sister and my friends have been telling me for a long time that I need to let go. But that's the hardest part for me. I worry a lot. They get sick, and when they die, because they will die sooner or later,
we have already put her on a diet. She is very comfortable where she is. And I tell you, she has the potential to be happy. And that's what we do. Right now we're buying time for Nikki. Was that clear enough? I think maybe I managed. And once again, I am sorry for yesterday's video. What a mess. What a mess. But entirely my responsibility, entirely my fault. I apologize for that. So that's Nikki's plea, and that's Nikki's story. She needs your help. She needs to go into surgery to be operated from a pancreatic tumor called insulinoma. It's not an easy surgery, but hey, nothing's easy. Please donate. Help us save her. Thank you.
Well, here we are with Nikki, whom we rushed to the clinic. A lot has piled up. She has an abscess on her rear, and she's really uncomfortable. Everything hurts, which is why she's trying to bite a little. Here I have our friend Nikki. And the abscess is pretty bad, bleeding, so we're going to see what the vets say now. Poor thing. She's really going through a rough time, one thing after another. And she keeps developing new issues all over. But she never loses her affection. Despite everything, she's still very loving. Although her behavior can be a bit odd sometimes due to the pain.
We're going to take some blood.
She has quite elevated leukocytosis with neutrophilia, likely due to the abscess. Also, her blood glucose is at 72. The lower limit is 74, so she's right on the edge. Everything else looks pretty good. The electrolytes and the rest are within range.
That's a relief.
Nikki is already sedated. We're going to place the IV lines and clean everything to see what's going on with the abscess, where it's coming from and all that. Why are you doing that?
To give her a pain block.
This whole line here is where the lesion extends to, but we don't know if that skin is going to necrotize and fall off or not. It might just be a hematoma that stays put. We've seen these progress to necrosis and form a hole of this size. Now we're heading into surgery to see what we find in Nikki's abdomen and figure out why she's having these hypoglycemic episodes. This white line that's moving is the pleura. So the anaesthetic is injected here, and what it does is push this white line downwards.
My goodness.
Is all that fat?
This is the falciform ligament.
And what's it for?
It covers the organs.
And do you just remove it like that?
Yes, it's no problem. It also lets us work better.
This is the pancreas. It looks good.
Very good indeed.
Now Isidore and Rebecca are examining the pancreas to see if they spot anything.
There are no signs of congestion, inflammation, or pancreatitis. Right. We're going to take a biopsy of the pancreas since there are no signs of any obvious tumours or inflamed or reactive areas. We want to see if there's any anomaly at a microscopic level.
With the sample we've taken from the pancreas, we'll go ahead and sterilise her. Did you say you saw ovarian cysts?
Yes, a small cyst.
Nikki, are you awake already? Nikki will stay here tonight so they can monitor her just in case anything happens. Although there's no reason to think anything will, but she'll be under observation. Well, we'll see you tomorrow, Nikki, and you'll come home, all right?
It's an animal world out there. Watch the World Animal Awareness Society channel and feel right at home. Come, sit, subscribe, and stay a while.